Medical Dialogues. I'm Anshika Mishra. Today we'll talk about prediction of psychosis before its onset. An international consortium, including researchers from the University of Tokyo, developed a machine learning tool capable of predicting the onset of psychosis before it happens. This tool classifies MRI brain scans into two categories, those from healthy individuals and those at risk of a psychotic episode. Psychotic episodes, characterized by delusions, hallucinations, and disorganized thinking, can happen to anyone due to triggers like illness, trauma, drug use, medication, or genetics. Though potentially distressing, they are treatable, and most people recover. But identifying those in need of help can be difficult, especially since these episodes most commonly begin in adolescence or early adulthood, a time of significant changes. At most 30% of clinical high-risk individuals later have overt psychotic symptoms, while the remaining 70% do not, explained Associate Professor Shinsuke Koike from the Graduate School of Arts and Sciences at the University of Tokyo. Therefore, clinicians need to identify that those who will go on to have psychotic symptoms using not only subclinical signs such as changes in thinking, behavior and emotions, but also some biological markers.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The team from 21 different institutions in 15 different countries gathered a large and diverse group of adolescent and young adult participants. According to Koike, MRI researchers into psychotic disorders can be challenging because variations in brain development and in MRI machines make it difficult to get very accurate comparable results. Also, with young people, it can be difficult to differentiate between changes that are taking place because of typical development and those due to mental illness. For the research, participants were divided into three groups of people at clinically high risk: those who later developed psychosis, those who didn't develop psychosis, and people with uncertain follow-up status, and a fourth group of a healthy control for comparison. Using the scans, the researcher trained a machine learning algorithm to identify patterns in brain anatomy of participants. From these four groups, the researchers used the algorithm to classify participants into two main groups of interest: healthy controls and those at high risk who later developed overt psychotic symptoms. In training, the tool was 85% accurate at classifying the results, while in the final test using new data, it was 73% accurate at predicting which participants were at high risk of psychotic onsets. We still have to test whether the classifier will work well for a new set of data. Since some of the software used is best for fixed data sets, we need to build a classifier that can robust classify MRIs from new sites and machines, a challenge which a national brain science project in Japan called Brain Minds Beyond is now taking on, said Koike. If we can do this successfully, we can create more robust classifiers for new data sets which can then be applied to real life and routine clinical settings. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.